Of course, the discussions at BRICS are very much focusing on building economies and cooperation and unity, moving away from the dollar, helping poor nations, and all those are really important. It's important that we grow economies, that we grow jobs. But there's something that if we don't have it, it doesn't matter how much money we have, and that is our health. And it's a vitally important issue that public health programs also be discussed, and specifically combating preventable diseases. Now, Professor Corinne Hofman is director of the SAMRC Centre for Health Economics at Wits University. She believes this is a potential missed opportunity, and she joins us now. Prof, thank you so much for joining us. You know, it's such an interesting topic because a lot has been made of the fact that this is the first post-COVID in-person BRICS meeting. And there's lots of discussions about lessons from the pandemic, which of course is a viral illness, you know, that no one could really have anticipated. We knew it was coming at some point. But you're really concerned about the impact of preventable illnesses and how they are causing massive lifestyle diseases, particularly obesity, diabetes. Talk to me about why you believe BRICS countries should pay particular attention to these diseases.
Thank you, Sally. So the thing is that the number one threat to the health of all the BRICS countries, each and every one, are diabetes, heart disease, stroke, high blood pressure, and cancer. Those are the things that are going to kill people in the BRICS countries. Diabetes is doubling every decade in South Africa. All the BRIC countries, diabetes has been rising for 30 years. And in fact, a recent article suggests that the key disease of the century is going to be diabetes. And how has this happened? How has this actually occurred? It is the consumption of sugary drinks, processed foods, high in sugar, salt, and fat. It is the number one cause of death, as I said. And we need to safeguard the publics of the BRICS countries, which constitute 40% of the world's population, from these conditions, and the fiscus from the costs of these diet-related diseases. This is really essential. And it's being fueled by companies, by commercial food companies that have said they are going to deal with countries that are no longer in the global north. These are their growth markets. They are targeting the BRICS countries. They are targeting Africa. They are targeting South Africa. It is an epidemic of huge proportions. In fact, there's a term that's been coined for these conditions they are driven, these obesity-related conditions, overweight conditions, all of them are fueled by what is called commercial determinants of health. What do I mean by that? It is the private sector activities that are directly or indirectly impacting people's health. And these situations we have to deal with them as a country in South Africa, but also as the BRICS countries, we have much more leverage doing that. Both India and South Africa now have a sugary beverage tax. Other countries in the world, like Chile, have stopped marketing to children. They've banned marketing to children. They have food labels on all their foods. South Africa is about to do that, I hope. And we need to get going so that we can address this huge tsunami that is affecting our country and all 5 of the BRICS. And it was not discussed at all at the BRICS Health Summit, which took place 3 weeks ago in Durban. One of the things they talked about was universal health coverage. How are we going to cope with universal health coverage with this tsunami of obesity-related conditions? They talked about a BRICS TB network. Critical, really important. Does everybody know that people with diabetes are at very high risk for TB? Right now in South Africa, most of the people who get TB, or a lot of them, have HIV. But in the future, it's going to be people with with diabetes.
It's so interesting what you're saying, and I just want to jump in because you've spoken about the sort of the commercialization of these foods, and there's so much science and psychology that goes into creating what is known as the bliss point, just to make us crave them more and more and more. So it doesn't matter how strong your willpower is, it is very easy to get almost addicted to these foods. And quite chilling what you're saying is that these companies are getting a lot of flack in Northern Hemisphere regions because they've seen the impact on public health. And now the drive is on developing countries. And it seems at odds in a way because obviously we want business to grow, we want people to get jobs, but we can't do it the wrong way. We can't open up to fast food outlets that are cheaper than proper nutritious food. And I think you're making a really important point am I right, that we are not, as a unit in BRICS, harnessing the power we have to push back against this.
That is correct. This is a new form of colonization. Multilateral companies are doing this, and there are some countries within the BRICS that are dealing with things in a different way. So, for example, with regard to sugar, there is no reason to lose jobs as a result of sugar issues, growing of sugar cane. Both India and Brazil have made huge strides in turning their sugar cane into ethanol, which supplements their petrol for energy. Okay, we are in an energy crisis here in South Africa. Why have we not done this? People have been talking about this for years. People say, oh, we've got this in the Sugar Master Plan, delay, delay, delay. We need to do it. We need to address the issues in South Africa. And we need to look to our counterparts in the BRICS for lessons that they've learned already to deal with the issues that relate to public health and not destroy the economy at the same time.
We know that India really has been on the front foot of vaccine production. We know that South Africa, along with a number of other African countries, absolutely critically important that we get better at vaccine production. But if we look, you mentioned cancers. We know a lot of cancers are lifestyle linked. But if we look at the HPV vaccine, which prevents and has almost wiped out cervical cancer in some countries, are we seeing that sort of preventative medicine still being pushed as strongly as it should be in developing nations?
Not really. I mean, it should be done. It certainly is something that South Africa has attempted to do. It has not been all that successful with HPV. And one of the things is we really need to deal with price negotiations. And maybe we should be dealing with price negotiations as a block, because many of these companies that manufacture vaccines don't sell them at the right prices. So we really do have to do that. South Africa has introduced HPV. It's been partially successful for school children.
Right. Yeah, and as you say, the cost of vaccines, that's a really important one. Specifically looking at South Africa, you mentioned, that we've been fairly forward-thinking in putting in place a sugar tax. What do you see South Africa's role here? What could we be doing uniquely within BRICS that we're not currently?
Well, I think that the one thing that we should be doing is dealing with the bans on marketing to children. I think our children are being bombarded with messages about, as you say, the bliss point and products that are advertised constantly from a small age of 2. They're seeing these things and it becomes second nature to eat all these products. So we should be leading the way in saying how these things should be regulated, as they do in Chile, for example. We can look to other countries in the world where many of these interventions are going on. And I think that South Africa has become a leader, for example, in salt regulation. We now have much less salt in our processed food than we used to, and there's much less salt in bread. And that is mandatory because the voluntary regulations just don't work.
Yeah, absolutely. And it's something that is so easy to not think about. But the truth is the long-term impact of a bad diet, too much sugar, processed food is going to have a massive, massive impact on our future health as a nation. A missed opportunity indeed. Let's hope it will receive attention now. Thank you very much, Professor Karen Hofman. She's the director at the SAMRC Centre for Health Economics and Decision Sciences Prices Program. That's at Wits University.